Hate. Taka. Ear, nose and throat. You know that ear, nose and throat is very sensitive organ. Meaning to say that if something happens in the nose, then you will be disturbed. If your hearing is reduced, you will be paralyzed. You will be isolated from the world. You cannot do your job. Yeah. And so for ENT, I am working in KPMC since last 1 year. Before I joined KPMC, I worked at certain places, certain countries like Saudi Arabia, India, and since last 20 years, I am in Malaysia. I worked in one of the university as well as a senior lecturer, International Medical University. My main interest of subject is something like otology. Otology is ear, telinga. Yeah, so I did so many surgeries and get expertise in doing this ear surgery, like endoscopic ear surgery. I am trained in Australia. Hysterectomy, ossiculoplasty, then even I am trained for cochlear implant as well. But cochlear implant needs bigger setup, so we are not doing. But otherwise, I am doing more rhinological surgeries like endoscopic sinus surgery and balloon sinuplasty. That is a recent and advanced technique that we use for particularly sinusitis. And that one is bloodless, and within a day patient can move around. Then throat is something like lot of people, they have this obstructive sleep apnea and snoring, we call denkur. Okay? So patient has some obstruction inside the oral cavity and the nasopharynx. So we do OSA surgeries as well. And in the throat, you know that we have tonsils. So we have a lot of children, they get this tonsillitis, and even adults. So we are doing this tonsillectomy by using, you will see later, this harmonic scalpel that is most advanced. That patient get less bleeding, no pain, and faster as well. So in KPMC, we have set up our ENT clinic like this. So we have all ENT treatment unit. It is equipped with a video otoscope, endoscopes, and camera system as well. So we can do clinical procedures here with comfortability of the patient. Next. This is the normal otoscope ENT surgeon they use, but we are using this video otoscope, so that straightway we can see on the screen, and we can record that one as well for future reference, so that it will be easier and comfortable, and that is advanced. Yeah, next. So next, ear examination. How we do this ear examination? This in our ENT clinic in KPMC. Click next. So this one is for our otoscopy. Yeah, video otoscope, so that you can see the picture like this. And this is the microscope what we use for our ear examination. So what we treat for ear, apa masalah macam di telinga ke, what are the conditions that patient will have? We entertain. Next. So like you know, in the ear patients, so many patients they will have this impacted earwax, macam di dalam ini telinga ada daya telinga, so it is impacted and then it becomes something like stone and stony hard. So that patient will have pain. Some of the time patient will have reduced hearing, blocked ear. So in particularly children's, they develop this otitis media with effusion kita cakap itu glue ear di dalam ini kegendang telinga ada glue macam glue. So that also patient we see the patients. Foreign body yes, deafness. So ujian pendengaran dan some other investigations also we do. Then we have this vertigo clinic as well. We run this vertigo clinic, so we entertain untuk pusing-pusing. We assess and for treatment as well. So for these conditions of the ear, what we do this kalau ini itu ada macam di dalam air ke apa glue ke apa di dalam ini gendeng telinga, dibuat ini itu myringotomy. Previous one. Myringotomy, then endoscopic myringoplasty, tympanoplasty, mastectomy, then vertigo assessment, audiological tests, and those who have this very hard to hear, so kita again into hearing aids. Next, so we see what these conditions I explained here. We see in pictures how it looks like when we see in our clinic, because we are using this endoscope to see the condition. Click on. So this one is macam we pakai itu endoscope macam begini, and then we see the ear. This is kegendang telinga ini normal. Next one is acute otitis media. Ada air macam di dalam ini telinga kegendang, so it is bengkak, macam it's swollen and red. So when it is remaining for longer time, patient may get this pus collection inside the gagandang. Madam, you can see the pus di bawah ini. And this one is air bubbles. Sometimes the water inside the ear, it moves and creates bubbles. So we can see the bubbles. We call secretory or blue ear. This one is gagandang macam di dalam ini. So retraction. Next. More ear conditions like ini foreign body, batuk, then gagay ini itu telinga, ini otitis external. Yeah. So these mainly those patients who have discharging ear for long time, they may have this lubang di dalam gagandang, itu perforation. So we examine here and then later we do this endoscopic myringoplasty, which is more convenient, easy, faster and less bleeding. And these all are cholesteatoma. Kita cakap ini itu cholesteatoma, ini itu makan tulang di dalam, ada penyakit jangkitan kuman di dalam ini gendang telinga di atas. So that one is we call cholesteatoma. For that we have to do this mastectomy. Okay, next. Okay, click this one. This is just for the procedure what we do endoscopically. Pakai endoscope and then we do this procedure for ada di dalam ini air. So we put endoscope and then cut it. This one also. So patient got perforation like this and then we do this endoscopic ear surgery. Macam tampal di dalam ini tu. Gagandang we after this one, you know, this we puncture the drum and then we through suction and then remove the fluid inside. Ini di dalam ini gagandang telinga. Kita macam potong ini to skin and then put like that, retract. And then we see inside, kita letak itu ada macam kulit di dalam ini, and then it will be closed. So now we go to move to nasal problem. Hidung punya masalah, apa masalah ini tu hidung. Hidung, you know the hidung is very sensitive area. And then a lot of patients they get this blocked nose, and then the nose is surrounded by sinuses like maxillary sinus, frontal sinus behind the ethmoid sinus and all. Go ahead. Next. So for the nose, what we do conditions like stuffy nose. Main normal patient they refer this stuffy nose as a sinus problem. Ini macam sneezing, bursting, orang banyak itu cakap sinus problem semua. So we call this one is a chronic rhinosinusitis, allergic rhinitis. A lot of patients allergy to pollen, sneeze, that and all, house dust mite. So we entertain the patient to do these allergic tests, identify the allergen. After identification, what? Usually the doctors, they will tell that you have to avoid this allergen. But there is one advanced treatment available that is we call immunotherapy. Immunotherapy macam ada nowadays before they have injections only. Now we have this oral medication as well, tablet and drops as well. So we treat this allergic rhinitis. Nasal obstruction macam ada macam bengkok, tulang itu this one inside the nose deviated. Nasal polyposis. So many allergic rhinitis patients they get this banyak polyp di dalam itu. Dan epistaxis pun. Epistaxis is bleeding from the nose. So we do endoscopically cauterization, bakar di dalam itu hidung. So bleeding will stop. Important is nasopharyngeal cancer. In these regions we have banyak ini itu nasopharyngeal cancer. So we do screening and take biopsy and confirm, then later we refer to oncologist. What services we offer? Endoscopic sinus surgery using this nasal endoscope and mitral debrider. So it's easier, faster and safe as well. Balloon sinuplasty is, later we will see this balloon sinuplasty video as well. Septoplasty, urbinoplasty, ablation, endoscopic adenoidectomy, and allergic tests and sublingual immunotherapy as well for the allergy rhinitis. Next. This is the way we do this. We use this endoscope, we examine the nose like this, and then we put the endoscope inside the nose so we can see the nasal structures inside, and then we can identify the polyps or swollen or that the turbinates are enlarged. Next. So this is the deviated nasal septum. So this is the nasal cavity. So this is bangkok. So we do operation endoscopically and then luroscopy, straighten, so that patient can breathe nicely. These all polyps in the nose. Next. So what are the conditions we see? How we treat sinusitis? Sinusitis is like this. So we see this is endoscopic picture of the nose. We see a lot of pus inside. So for that, we have to treat the patient. So this is the instrument we use. This equipment is advanced equipment, and then we put inside the sinuses like this, and we dilate so that it will not be blocked. Next, this we see the video. Or nasal conditions. Again, these are the nasal conditions we see in picture. Endoscopically, we look for the sinusitis, deviated nasal septum, banyak ini macam polyp di dalam hidung. All these are the polyps, and like this one is allergic rhinitis. Okay. So this is the balloon sinuplasty we do at our center using this balloon. So balloon we will push the balloon inside. It's going inside. Madam, near us. The picture will come out clear. That will show that the light is seen on the forehead, madam, near us. So we confirm. Then we push the balloon inside. Dilate. Like this. You can see the picture here. So this is seen the light on the forehead. Di sini. Habis kan? Finish? Okay, this one is a throat. And these are the conditions we look for the throat. Throat is, this is normal picture. Click again. This is tonsillitis. Okay, and this is the abscess inside the tonsil. So we call tritonsillar abscess. Last one is, I think, video. Go ahead, next. Next. All these are the Petiswara conditions. We use the 70-degree telescope. Next. This is important for tonsillectomy. Lot of patients, they have these tonsil problems, tonsillitis. Kita pakai ini harmonic scalpel, ini macam forceps, and then we do this operation by cutting this tonsil straight away. So it is a special instrument that will not allow blood to come out. So you can see that.
Oke, baik, terima kasih Dr. Rafiq dan
Thank you so
sebelum
much.
ya thank you so much. Sebelum kita lunch makan siang, saya berikan 3 pertanyaan saja yang ingin bertanya.